Hello everyone, welcome back to my channel. This is Li, a pathology at Geisinger Medical Center. Today, let's talk about bone and soft tissue tumor of the head and neck. With this entity to cover, I'm going to divide this lecture into two topics. This is the first one. The first entity, let's going to talk about Nasopharyngeal Angiofibroma. So this is a benign tumor, usually with this fibroblastic tumor cell and richly vascular. So one clinical feature is that usually we can see this lesion in young men, peak age of second decade. And when we talk about angiofibroma, you must figure out, because we have at least four entities besides nasopharyngeal angiofibroma. We have the name of angiofibroma. The first one is fibrous papule. We usually use this term in the face and nose in the dermatopathology term. And then the other one is angiofibroma of soft tissue. This kind of angiofibroma is kind of deeper soft tissue mass, characteristic by tons of vessel. Then the other one is cellular angiofibroma of the genital. Characteristic finding is the immunostaining that is CD34 positive and albumin lost. And then the last one is giant cell angiofibroma. This is one variant of the solitary fibrous tumor, which we will talk about later. So do not make you confused about angiofibroma. So in the gross image, we can see this polypoid lesion with this really whitish looking surface that is making of this spindle cell. And then we have a lot of blood vessel around. So in the characteristic feature, just bear in mind everything in this angiofibroma, nasopharyngeal angiofibroma should be bland looking. You can see tons of blood vessel with this spindle, bland looking endothelial cell, and then in the stroma you have this spindle cell, some stellate cell. They not look the same, but they are bland looking. So we have tons of blood vessel. You also can see this is the Stadthorn vessel. I will talk about Stadthorn vessel again. Just remember this shape. And then the bland looking endothelial cell, and then this stromal tumor cell is spindly, stellate, spindly looking, kind of hypocellular. You can find this sclerotic stroma as well. One characteristic IST finding is the beta-catenin positive stroma cell. If you still remember, this lesion usually in the male, so you can find antigen receptor positive. But remember, SMA, desmin, and CD34 negative. Let's see some virtual slide. So in low power, we can see this mass. Even in this scanning magnification, you can see tons of blood vessel. So you can think about this entity, angiofibroma. So you need to bear in mind that the vessel wall, you do not find any hyalinized blood vessel wall. The vessel wall is kind of cellular. And then between this vessel, we have this hypocellular area. You do not see tons of cell compared to other sarcoma. And then characteristic finding of this sclerotic stroma. And then look at this bland looking spindle cell. They are beta-catenin positive and CD34 negative. Some cells look the same. Some cells they have this stellate shape, different kind of shape. Not all the cell looks identical. See this stellate shape, but overall they are bland looking. So just two component vessel and this sclerotic stroma. One more entity, even in low power, tons of blood vessel. And between this vessel, we have this sclerotic stroma and this spindle cell. really all the area look like the same. This thin wall black vessel is characteristic for nasopharyngeal angiofibroma. We will talk about the differential when this lecture is going on.